Hi, thank you for joining me today for our presentation entitled Recreational Cannabis Legalization and Exposures in Children. To start with a brief background about cannabis policy in America, we know that in 2012, Colorado and Washington became the first states to legalize adult recreational cannabis use. And since then, there are now 12 states, if you include Washington, D.C., that have passed similar legislation. The data shows that decriminalization of cannabis has been associated with increased exposures in children on a national scale. And data coming from both Washington and Colorado have suggested that legalization of recreational cannabis use in those states has been associated with a rise in exposures in children too. Despite these well documented risks, public opinion is very much still in support of progressive cannabis policies, with about two-thirds of adults in a recent survey saying that they support it. So, we set up a study to look at how recreational cannabis policies on a state level are associated with pediatric exposures in young children. And to do this, we looked at 4 years of poison control data from the National Poison Data System, that started in 2007 and ended in 2018. We included children who were aged 5 years old or younger with single substance cannabis exposures in US states and DC. And we used two generic exposure codes, that for dried marijuana plant and that for edible marijuana preparation. We excluded anyone with unknown or multiple ingestions or calls from the US territories. In doing this, we retrieved just under 2,100 cases that met criteria, which were subsequently divided into legal and illegal states based on what that state's recreational cannabis policy was as of December 31st, 2018. This left us with 9 states that were deemed legal states, including Alaska, California, Colorado, Washington, D.C., Maine, Massachusetts, Nevada, Oregon, and Washington State. US Census data was then used to convert the total calls in these states to rate per 100,000 children aged 5 and younger. And then we used Poisson regressions to analyze whether these were statistically significant differences between states by legalization status. So what we found here in Figure 1, these are just total calls to poison control centers for kids under 5. And um, the first thing that I think jumps out is that very clearly there is an upward trend in calls for these young kids nationally. That in all states, whether legal or illegal, the numbers on the right side here are far bigger than the numbers on the left side. And you can see in 2018, they had 1,200 calls compared to just 97 in 2007. The other thing to keep in mind here is that these generic exposure codes were expanded in between 2008 and 2017. So this edible marijuana preparation was not an available choice for coders or in this data set in 2007 and 2008. But you can see that once it was available, it was quite prevalent. And if we look at 2018 here, we see that in legal states especially, 514 cases were because of edible preparations, compared to just 168 of traditional dried marijuana plant. So here we show graphically the difference between legal and illegal call rates for kids under 5, and we see that there's a very clear discrepancy between legal and illegal cannabis legalization status. The two groups notably start off with very similar rates. So 2007 and 2008, you see that the two lines are very close together, and then we see that there's this quite broad divergence to a point where in 2018, legal states were almost 5 times as likely as illegal states here for that year in particular. So then to look at the statistical analysis here briefly, we see that the years for 2017 and 2018, when we run these Poisson regressions, we see that kids in those states are about 2.2 to 2.25 fold more likely over illegal states to be exposed to cannabis, and that this is a statistically significant difference. And finally, our last figure here, we look at a map of call rates in 2018, and these are just total calls in each of these states per 100,000 kids under 5. And you see that the dark blue states very closely replicate a map of where recreational cannabis is legal right now. So you see the whole West Coast and Nevada and Colorado, Michigan, Maine, Massachusetts, DC, all taking up um, places in the top quartile here, this dark blue color. So I think reflecting on our study briefly, it is consistent with some earlier data that showed that liberalizing cannabis policy is generally associated with increases in pediatric exposures. Um, Nationally, it was shown that decriminalization did something similar, and on state levels, it was shown that recreational use legalization had this type of effect as well. Clearly, this study didn't take into account medical cannabis, which could have been a potential confounding factor in some of these states. And it called for a bit of interpolation in the years between 2008 and 2017. However, some of these state level studies were published during that time and also sort of painted a similar trend and picture that we're describing here. So a big thank you to my two co-authors, Alisa McQueen and Michael Wahl, and a big thank you to all of you for joining me. Thank you all. Stay safe.